My name is Joo-Young Lee. I'm a member of the Committee on Economic, Social, and Cultural Rights, which supervises the state parties' implementation of the International Covenant on Economic, Social, and Cultural Rights. The right to sexual and reproductive health is an integral part of the right to health, which is enshrined in Article 12 of the International Covenant on Economic, Social, and Cultural Rights. This right includes both freedoms and entitlements. In other words, this means that everyone should have control over their own body and sexual identity. People should be able to make free and informed choice about their sexual relationships, such as when, with whom, and whether or not to have sex, as well as decisions about having children, including how many and when. The right to sexual and reproductive health also empowers people to avoid unintended pregnancies, prevent sexually transmitted infections, including HIV and AIDS, and combat the stigma and discrimination often associated with these issues. To make this a reality, states must ensure people are protected from gender-based violence and discrimination and have access to services and information for the right to sexual and reproductive health. This includes comprehensive sex education, a range of modern contraceptives, HIV and STI prevention and treatment, and safe abortion services to those who need them. Furthermore, states must make sure that pregnant women and girls have access to the necessary health services, along with underlying determinants of health, such as nutritious food and clean water. The committee has clarified the meaning of the right to sexual and reproductive health, which is contained in our general comment number 22. When the committee reviews how state parties are implementing economic, social, and cultural rights, we address questions concerning the right to sexual and reproductive health. If the committee finds that the state party need to improve their efforts, we provide recommendations to help ensure the right to sexual and reproductive health is better implemented. In the last 3 decades, since the International Conference on Population and Development in 1994, there has been significant progress in advancing the right to sexual and reproductive health. Access to contraception has expanded, reducing unintended pregnancies and giving people more control over their bodies and future. Globally, pregnancy and childbirth have become safer, and maternal deaths have decreased because of better access to skilled health care and emergency obstetric care. However, despite these advances, many people around the world are still denied their right to sexual and reproductive health due to restrictive laws, policies, and harmful social norms. Sexual and reproductive health services are often inadequately funded, and many women are unable to make their own decisions about health care, contraception, or sexual relationships. Because of persistent gender discrimination and stereotypes, unsafe and stigmatized abortions remain a harsh reality for many. In the situation of armed conflict, these challenges are even more severe. Armed conflict disrupts healthcare systems, leading to higher risks of maternal death. Access to contraception is often restricted, leading to more unintended pregnancies and unsafe abortions. Tragically, gender-based violence is also frequently used as a weapon of war. Whether we can see better future for the right to sexual and reproductive health, I think depends on the role of many actors. including the state parties to the covenant, civil society organizations, individuals, and communities. A crucial step toward progress is challenging the social norms and practices that perpetuate gender-based discrimination and stereotypes, which hinders access to sexual and reproductive health services and information.